Good evening and welcome to this evening's discussion of the power of health, education, and promotion. I'm David Hahn, Associate Dean for Academic Affairs at Metropolitan College of New York, and I'll be serving as the technical producer of this evening's event. We'll be joined shortly by Ms. Tina Giorgio, the college's Director of Alumni Relations and Communications. She will respond to your comments and questions in the chat. Please feel free to post your comments and questions there. And with those arrangements mentioned, it is my pleasure to introduce your host for this evening, Dr. Adele Weiner. Dr. Weiner is a longtime full-time member of the college's faculty and the director of the college's Master of Community Health Education program. Dr. Weiner.
Hopefully, Dean Arnavini will be here shortly to offer her welcome to us, and when she gets here, we'll put her on. I want to welcome all you for being here tonight. We have a very interesting program planned for this evening to talk about some of the aspects of health education in general. And in particular, our area of expertise is mostly community health education, which is our brand new program at MCNY that started last fall during the COVID epidemic. And we have graduated this summer, our first cohort. So we're just a brand new program. And we thought we would, in honor of National Health Education Week, have a program. So thank you for coming. I'm going to ask each of the speakers to introduce themselves when they start their presentations. And I'm going to be the first speaker, and I'm going to talk about what is community health education, what are some of the job employment opportunities for people, and some numbers from the Bureau of Labor Statistics on projections for employment for community health educators. And one of the really interesting things is we live in interesting times for community health educators. COVID has really pointed to the need for health educators across the board in everything from medical settings to other kinds of settings. And health educators have been very much involved in the COVID pandemic and getting information to people about everything from the vaccine to how a virus works and replicates to understanding why some people are more at risk than others. So what do health education specialists do? Well, they work with individuals, families, and communities in public and private organizations, almost any kind of organization you can think of. We'll talk a little bit about those in a minute. And what they do is they create, implement, oversee, and analyze programs and strategies that promote health and wellness or well-being for the population. There is a difference between community health education or health education and public health. Public health focuses primarily on policy and research. Health educators focus more on getting information to people and developing programs that meet their needs. So what are some of the things they actually do? Okay, they teach people how to live healthy lives. That includes everything from diet to exercise to preventive checkups, seeing your doctor on a regular basis, taking your medication, almost anything that you can think of that would improve the quality of life for somebody. They help people get preventive screenings, whether it be for diabetes or for high blood pressure, so that they can keep track of their illnesses and deal with them. They also help people to try to avoid what we call costly diseases. medical procedures and unnecessary hospitalizations, because if you can track your blood sugar for your diabetes, you're less likely to have an episode that's going to end you in the hospital, and is going to cost you a lot of money. Okay. And they help identify needs, the needs that people have, and connect them to the resources to meet those needs. So in a way, they're a combination. They do a little bit of public administration and a little bit of counseling and a little bit of social work, to bring it all together to focus on people's health and wellness. In addition, people have, or as we grow older, we have what we call normal expected life changes, right? The birth of a child, a marriage, a death, those kinds of things. And so they also help people deal with their expected life changes. So for example, they may work in a hospital or clinic doing prenatal or well baby care, teaching those kinds of parenting skills to new parents on everything from how to bathe the child to what baby foods are good for children. And prenatal care in terms of getting vitamins and seeing your doctor and having all the tests that you need to have done. With teenagers are always fun. I always talk about teenagers as sex, drugs, and rock and roll, but sex and drugs are a universal issue for many teenagers. And in fact, suicide has become a major health issue. One of the things we know about during COVID is that for some groups like teenagers, depression has doubled. So the number of teens experiencing depression is twice as much as it was before COVID. And that's probably because of the isolation. They're not in high school or college with their friends. They're not doing the normal things they expected to do. And so those are the kinds of education programs that people might work on for teens. And then when we look at senior citizens, well, extremely important are exercise and diet. So there are a lot of stress management programs that might use yoga and some exercise. And then there are diet programs, because again, a lot of the conditions that older people experience, osteoporosis, hypertension, high blood pressure, type 2 diabetes, which develops in older age, can all significantly be controlled, maybe not perfectly, but can be controlled with diet and exercise. They still might need to take medications, but they may not need to take as much medication. Also, the chances that they have a critical event. One of the things about some diabetics is we call them brittle diabetics. If they get upset, their blood sugar spikes. So, helping people learn stress management and relaxation techniques can help them maintain their blood sugar levels at a level that's safe for them. And they serve, so community health educators work in almost any kind of setting that you can think of. They're not just in social service agencies or public agencies. They do work in hospitals. In fact, all the hospitals that I've been speaking to in New York City require that people have masters in community health education and have what Professor Williams is going to talk about, a credential called the CHES credential. So this is, it's a field that's becoming professionalized. I forgot to introduce myself, but I fell into the field. I'm a social worker, truth in advertising. I can't get the CHES exam because I didn't take the kind of coursework they require. I do have a New York State license for social work. But I was one of the first social workers working in the HIV/AIDS epidemic at the beginning of the epidemic in the 1980s. And I have always worked, so I was involved in programs for prevention, which in fact are health education programs. So that's how I kind of fell into community health education. But they work in hospitals. They work in clinics. Now, some of you may be aware of clinics like CityMD, but you may not be aware of the fact that most of the major hospitals have clinics throughout the city. You know, the hospitals are in large systems like Northwell, Montefiore, Columbia Presbyterian isn't just one hospital, it's multiple hospitals. And those multiple hospitals often have multiple clinics serving specific needs. So there can be a diabetes clinic in a community. There can be, you know, a well baby clinic, a senior clinic in a setting, you know, that's in the community. So they work in clinics. And as I said, well baby, you know, clinics and those kinds of things. They also work in schools. Now they are slightly different. They're different levels. There are people who have teaching licenses that are called health teachers. We all remember those, right? Those are the people, often the gym teacher, who would teach you about sex and using condoms. But, you know, health education today is very different. And a lot of it focuses on nutrition for children and exercise for children and other kinds of things. But schools employ both kinds of health educators. They employ the ones that are actually teaching in a classroom and have teachers' licenses, and then also the ones that are health educators, trained as health educators to design programs. In New York City, one of the things I've noticed is a lot of the different schools will have a nutrition open house kind of event, you know, like a weekend event where they have different groups coming in talking about nutrition and vegetables and, you know, why you should eat a certain way. And they involve the children in these projects. You know, the children might be making posters that get judged, or they may have cooking classes for children. So schools and then universities also. Universities use health educators in both their health and prevention and outreach programs, because many universities and colleges have a health center. It's also not just physical health, it's mental health too, and substance abuse, or substance use. And these are problems that often arise in colleges that pretty consistently before COVID, one of the scary statistics was that 25% of all traditional college students are on a psychotropic medication. 25%, 1/4 of all college students are on a psychotropic medication. And those medications are for some of the learning disabilities, but they're also for anxiety and depression and other kinds of mental problems. So you will have them in universities. You have them in government offices. They work in departments of health with the public health officials, because they're the people that are designing programs. They're the people that are doing outreach to the community. They're the people producing information for the community. One of the interesting places where community health educators work is in WebMD. They write those stories that you read about, you know, learning about diabetes or learning about, you know, different substances. SAMHSA uses health educators to help write their publications. So there are lots of different opportunities in this field. So they work in government, public health departments. And if you've been following it in the New York Times, it's a very dangerous time to work in public health. Some public health officials are getting threatened by people who don't want to wear masks and don't want to be vaccinated. And recently, corporations and businesses have created a position called the Chief Wellness Officer, CWO. During COVID, they're the people that make sure that the building ventilation is working right and that there's enough cleaning supplies and what's the procedure for cleaning. But they may also be people that work with what's called employee assistance programs. Employee assistance programs are programs that corporations use to make referrals for people that have usually some kind of a health need. Now, it could be a substance use need, but it also is stress, It could be dealing around the death of a family member. It could be dealing with helping an employee find a nursing home placement for a parent. So they're not hiring social workers in corporations. They're hiring people that are called health educators. Okay. And then they work in any kind of nonprofit you can think of, whether it's it doesn't have to be a medical one. It can be child welfare. It can be HIV/AIDS agencies. It can be the Veterans Administration. It can be unions. It could be any kind of organization that you can think of. There are positions for health educators. And in fact, we know that health educators are, at this point, according to the Bureau of Labor Statistics, one of the fastest growing professions in the country. Bureau of Labor Statistics says that there is a 13% growth expected in the next 10 years in this field. And the average for all employment in the United States is 8% right now. And you may be following in the Times that right now employers can't find employees because some of the minimum wage employees are deciding they don't want to go back to those jobs. They want to get better jobs, and they're either going to school or they're holding out for different kinds of jobs. So right now there's a growth in the need for employees. And but in health education, it's a much broader, much bigger growth span expected in the next 10 years. In addition, just to give you an idea from the Bureau of Labor Statistics, the average salary for a health educator across all the different areas is about $62,000 a year. That was their last estimate in 2018. They haven't done some new estimates yet, or they haven't reported them. The highest paying, of course, are hospitals and government. But the average is about $62,000. And those are for people with master's degrees. That's not for people with bachelor's degrees. People with bachelor's degrees can work their way up. But for people with master's degrees, they're going into jobs as supervisors, managers, program directors, and all of those kinds of different activities. One of the things that I think Tina's going to put up is a link to the National Commission on Health Education Credentialing's webpage on employment opportunities and the different settings. And the thing about those are that many of the jobs have different names. They could be prevention and outreach program director. They could be, case management director. They could be administrative director of whatever. So a lot of the jobs, they don't necessarily say health education specialist, but they are those kinds of jobs. Most people enter into a position and make it their own. Again, with health education, if you have a particular interest, I've done HIV/AIDS education for over 20 years. And it's still with us. And prevention is still a major issue. It's not in some cases, and this is the interesting thing. It's not that people don't know how to prevent AIDS. It's that they're not motivated to do it. They all know how to use a condom. They all know they should use a condom. But then when it gets down to it and everything is hot and heavy, they just don't have the motivation to stop and get that condom. So a lot of what health educators do is not just the knowledge, but helping people to do what they need to do. All right. So I want to thank you very much. And if you have any questions, we'll answer them later in our question and answer session. I'm now going to turn over the program to Barbara Talley, Dr. Barbara Talley, for her to talk about cultural differences, cultural disparities in health education.
Thank you, Dr. Warner. Thank you. Wow, this is such a privilege to be on this discussion as we acknowledge this Health Education Week. And I love the theme that that is for this year, which is the gateway to the future, the power of health education and promotion. And I like that because of the word power. And we have to understand the power that we have in this particular field. I know that over the course of the past few years, it hasn't been highlighted as much as it should or it could be. But one of the things that COVID has done was it was definitely highlighted the gaps within the public health system, as well as shown the opportunities within the field of health education and promotion. So I'm just thankful that we have an opportunity to just have this discussion. By way of introduction, I am an alumni of Metropolitan College of New York. I graduated quite a few years ago, a couple of years ago. I went on to earn my PhD at Walden University in public health, and I have also received my certification as a health education specialist. And professionally, my career in health education actually started through my church. I saw that there were quite a few health issues that we were dealing with within the faith community. And I said, well, this can't be right. We're building ourselves up spiritually, we're building ourselves up emotionally, but the physical part of us is declining. So I really wanted to do something about that. So I started the health and wellness ministry within the church, my particular church, and expanded from there. And then that led to me starting my own nonprofit organization that really looks at the health issues within a community. So I'm looking to do some additional programs through that as well. And I am also the Chief Operations Officer for a nonprofit in Queens. So I really have my hands in quite a few things administratively, and especially everything tying into health promotion. So that's where my heart and my passion is, and I want to just continue to go on with that. So just for a few minutes, I just want to talk about how we can impact and improve health education and promotion beyond some of the customary ways that we're usually looking to improve it. And given all of the events that have taken place over the past 18 months, COVID-19 has definitely exposed gaps within our public health system, as well as opportunities in the field. Opportunities to broaden and diversify the reach that health education practitioners beyond customary clinical approaches to health promotion. But more specifically, I want to talk about how we can use evidence-based and theory-grounded health education strategies, practices, and programs to advance social justice efforts through the empowerment of equity, access, participation, and rights. So the obvious question is, how can social justice be addressed through health education promotion? And we do that by addressing it through our social determinants of health. Now, the social determinants of health, or the social, economic, and physical conditions of the environment in which we are born in, live in, learn in, work in, and play in. These are the conditions that affect our health, our daily functioning, and our quality of life. Oftentimes, health education and promotion efforts are implemented through customary downstream strategies related to the individual's change in knowledge, attitudes, behavior related to health, as well as direct care delivery. However, addressing the social determinants of health allows health educators to utilize upstream strategies and interventions to impact policy, regulation, environment, and social economic factors to improve health. Now, the Office of Disease Prevention and Health Promotion came up with or established and identified 5 key domains of social determinants of health. 1 was economic stability, 2 was education, 3, health and healthcare, 4, neighborhood and built environment, and social and community context. Now, under the domain of economic stability, you have poverty, employment, food insecurity, and housing instability. Under the domain of education, you have early childhood education and development, high school graduation, enrollment in higher education, language and literacy. Under the domain of health and healthcare, you have access to healthcare, access to primary care, and health literacy. For neighborhood and built environment, you have access to foods that support healthy eating patterns, quality of housing, environmental conditions, but then you have crime and violence. And let's just stop there for a minute, because under this category, children exposed to violence may experience behavioral problems, depression, anxiety, and post-traumatic stress disorder. They may also show increased signs of aggression starting in upper elementary school. And exposure to violence in childhood may manifest in adulthood, resulting in greater risk of substance use, risky sexual behaviors, and even unsafe driving behaviors. And for the domain of social and community context, you find civil participation, you find discrimination, you find incarceration, social cohesion, and racism. And even when we look at social cohesion, strength of relationships and the sense of solidarity among community members, or the willingness to make sacrifices and cooperate with each other for the greater good. And if we look at that definition, we can compare it to what's going on with COVID-19 now and the vaccinations. That even with vaccinations, we still can't get everybody on the same page to at least participate in something that's going to work for the good of the greater. So that's one of the things that we want to look at as far as social determinants of health. Even with racism, it was shown to have been linked to low birth rate, high blood pressure, and even poor health status. So just to close, the impact of social determinants of health is so interrelated with health outcomes that one of Health People 2030's goals is specifically related to the social determinants of health, which is to create social, physical, and economic environments that promote attaining the full potential for health and wellness for well-being. So as we continue to promote health through the lens of social determinants of health, it is critical that we use our power to address promoting safe housing, transportation in neighborhoods, reduce and eliminate racism, discrimination, and violence, improve education, job opportunities, and income equality, access to nutritious foods and physical activity opportunities, reduce pollution, air and water, and language, and literacy skills can be built up through social determinants of health. By addressing the social determinants of health, we have the power to promote healthy eating habits and behaviors while reducing the number of food deserts that promote inaccessibility and unavailability of healthy food options within communities. Addressing the social determinants of health, we help the uninsured gain access to appropriate and sufficient health coverage while addressing community transportation barriers that impact the delivery of quality healthcare services. And one final thought, when we're addressing social determinants of health, we can teach English as a second language to potentially reduce health literacy barriers, as well as reduce the apprehension to seeking preventive care services, especially among immigrant communities. So even as we look at the clinical methods of addressing health, there is also an upstream method that we can use to address the situations before they even make it down to a lower stream. So I just thank you for the opportunity to be a part of this discussion. And I am going to turn this back over to Dr. Weiner.
Thank you, Barbara. Okay, our next speaker is Professor Desi Robinson, who I got to know years ago in her work in food justice. So I'm going to turn it over to her. She can introduce herself and her topic for this evening.
Hello. Thank you so much, Dr. Weiner. It's really a pleasure to be here. And it's funny, we got started and we were talking about not being able to see everyone. And so I've invited quite a few people. And so we have a bunch of esteemed colleagues and supporters here. And so I really want to welcome them and thank them. And I always love when I can see faces. And so I feel the spirit of the folks coming in. And so as Dr. Weiner said, I am Desi K. Robinson, and I am a professor in community health education. I am actually an alumni of the media management program. And it's interesting, Dr. Weiner mentioned that you can really do so much with community health as it pertains to like where you are and what your passions are. And that really is the case for me. And so my work is really around the intersections of media and popular culture and community health. And so I am a doctoral student in the behavior studies and health education program at Teachers College. I am actually a journalist as well as a professor. And so those intersections come together for me to be able to use media as a lens for amplifying the voices of people who are unheard, and particularly around community health issues. And so, for example, when we have a conversation about R. Kelly, what does that look like when we talk about consent? What does that look like when we talk about the worth of Black girls and the way in which he has been able to perpetrate crimes against Black girls for many, many decades? I've also had conversations around the ways in which media portrays marginalized folks. And so I've done commentary on shows like Cops and how it continues to amplify the heroics of police officers in communities where they continue to do harm to people who are marginalized, who are suffering from social ills, addiction, and just general marginalization. I also talk about disparities in media coverage around race. And so if we look at the coverage between white women and girls who go missing, and Black and brown and indigenous girls and women who go missing, that coverage illuminates a great disparity. And oftentimes when Black and brown girls go missing, they are often identified as runaways. So being able to really push media and hold media and popular culture accountable for the ways in which they display and showcase people of color, and the community health issues that we continue to tackle are really important. And so what I will speak with you about a little bit this evening is social justice. And so those are some of the things that are of real passion to me as a community health educator. And it really offers an opportunity to show how what we have gone through over this last year, you know, even coming out of the throes of the Me Too movement, racial uprising, immigrant rights, health rights, these are all social justice issues that can and are deeply addressed through the community health educator space. And so community health educators are the ones who are on the front lines. This pandemic has really illuminated inequities, and we have been able to address how community health workers and frontline workers are really the arteries of our communities. We've addressed accessibility in testing. And so our community health education students have really been able to unpack what is happening in their communities and the ways in which they, as community health educators, are going to address some of the social justice issues that we have been, you know, really tackling with and finally having conversations about. I mean, these issues have always been there. Police violence has always been an issue in our communities, but with the advent of media and technology, they have now become issues that we see in the forefront, and media and popular culture and that space has really amplified those. And so as community health educators and what I do with my students, I always ask them to look at the social justice issues that we have seen in the day as a community health educator. Okay, now we're looking at reproductive rights for women. We're looking at food justice issues. How are LGBTQ and transgender rights going to be addressed within our communities as we sit on the front lines? Are we pushing our health community to really fill in the gaps in the medical community where they lack understanding about trans rights and Black trans women? Are they understanding the violence that befalls the trans community? Are they understanding that the inability to have safety, to find work, to have housing, how does that affect their health and their ability to survive? In our classes, we've also had speakers come in who have been running for the city council, so they continue to engage with political spaces that are going to take the fight, the protest that they have, and be able to put that into policy. We've also talked about voting rights, understanding what voter suppression is. What does that look like? What do those laws look like? What are the ways in which we can mobilize our communities to register and to vote so that they're able as a community to make those decisions, to vet these people who we put in office, and to really let them know what our needs are and what our rights are. Black women's health was a very big issue in our classes. We talked about maternal rates, maternal mortality rates, the ways in which there are clear disparities between the maternal rates of white women and Black women. We've talked about a rising issue of uterine fibroids and how that is very prevalent in Black women, and the ways in which we can create initiatives around addressing those issues. We've talked about climate change. We talked about the recent ice storm in Texas and what that looked like. The events, the weather events in St. Vincent, what is happening in Haiti, and how do we address those climate issues? Even the flooding in New York City. There are a plethora of New Yorkers, because of disparities and being marginalized within the housing system, have had to live in basement apartments. Some of them are legal, some of them are not. And people are in positions where they are risking their lives to live in basement apartments in order to afford to be able to live. And so social justice issues that literally span from voting rights to climate justice, to healthcare justice, to refugee and immigrant justice, racial justice, income gaps, gun violence, food insecurity, and general levels of equity are all social justice issues, and all can be addressed within the community health education space. And that is really what we are doing to prepare our community health educators to do, to be able to use being on the front lines and promoting health and promoting the idea that you know what to do. Now, here are the ways that we can mobilize and really create equity in our communities by addressing those social determinants of health that Dr. Talley talked about. And so recognizing and understanding the power within the community health education space is really the ways that we can address some of the biggest social justice issues of our time. And thank you so much for this time.
Thank you, Desi. Our next speaker is going to be Michael G. Williams, who has been on the faculty at MCNY for a very long time, and he teaches both in the KSAC program and the community health education program. And he will tell you a little bit about himself and the topic that he's talking about. Thank you.
Okay, thank you so much, Dr. Weiner. What a wonderful panel. I'm so grateful to be a part of it. I am, of course, an instructor at MCNY. I'm also, you know, when Dr. Weiner talked about starting out in HIV/AIDS, I had a parallel track in the 80s. I was deputy director for the Brooklyn AIDS Task Force, and that's where my health education career began. Oftentimes, as Dr. Weiner talked about, the title health educator is subsumed on the other titles, but that's exactly what you're doing, health education. I'm also I'm the department chair for Health and Human Services at a small private college in Manhattan that has an articulation agreement with MCNY. I'm currently right now, as you can see in my office at Mercy Hospital in Rockville Center in Long Island, where after we are done here, I have a group, a late evening group with men talking about men's issues, which has to do with community health education. So you're doing community health education in many areas, whether you call it a counselor, case manager, those health educator is subsumed on many of those titles. And so my talk tonight is about the National Commission for Health Education Credentialing. It's an organization that attests to the knowledge and expertise and competence of health educators. And there are two credentials. One is the community certified health education specialist, and the other is the master certified health education specialist. So since the late 1980s, I've had my chance working at the Brooklyn AIDS Task Force, and I remember most of my staff were ACT-UP members, and ACT-UP members used to be very vocal and be very aggressive in finding funding for HIV education. Since then, I've had my chairs up until about 2015 when I applied for my master's certified health education. And keep in mind that the certified health education specialist credential and the MCHES are valuable, marketable credentials to have. They're comparable to many other professional certification. They've helped me, and anecdotally, I've been able to find so many different opportunities. Had I not had my chance, ACS, Administration for Children's Services, were looking for chairs I remember in the mid 1990s, after every time a kid dies, you know, ACS, I still call it BCW. You know, they change their names, they hire people to do different things to keep family reunification. The last time they were looking for CHEDs, or health educators, to do work with parents and at-risk youth, you know, drug education, you know, healthy lifestyles. And so I've been fortunate, and if it were not for my credentials, the CHEDs, and then now the MCATS, as consultant for Campbell not too long ago, I don't think I would have had these opportunities. Now, our program in community health education makes you eligible for the CHEDs. It's a educational requirement. For the master's certified health education specialist, you would need then 5 years of work experience as a health educator. So always keep in mind that some of the work that you perhaps have done in the past would be, you'd be eligible. You just have to demonstrate that it entailed doing health education practice. Now, I'm going to talk about the CHEDS exam. CHEDS exam is 165 questions. And the difference between the CHEDS exam and the master CHEDS exam is this, that the master CHEDS exam entails conducting or being knowledgeable about program evaluation. Whereas both credentials must cover seven areas of responsibility for health education specialists. Both exams cover these several areas, except the Master Certified Health Education credential puts more weight on program evaluation. It's a level of competence as an MCATS that you must develop. And as a Master Certified Health Education Specialist, I had embarked on a community health education program in my community of Far Rockaway, which is a mixed income community. And I was alarmed and concerned about the growing homicide epidemic among young African-American males. After scouring the relevant health, social, and behavioral science literature, I realized that it became an epidemic. It's a community health epidemic. And one of the areas of expertise that a community health educator must have is doing a needs assessment. So I did a needs assessment in my particular community, you know, using primary, secondary, and tertiary data, which is another competency of a health educator. I did a needs assessment and discovered, you know, using primary, secondary, looking at morbidity and mortality weekly, United States Department of Health and Human Services, you know, the CDC, using data to do a needs assessment and discovering what the priority areas are of a particular community. Different than many, many years ago, like missionaries, people would just go into a community and propose to know what a community wants, rather than actually doing a needs assessment. And I discovered and had published in 2015, I was the lead investigator looking at the homicide rate among 18 to 25-year-old African-American males, which is the leading cause of death in that particular demographic, in that particular age group. And so my article published in the journal, online Journal of Social and Sciences Research, is entitled Health Education Practice, Formative Evaluation of Violence Prevention Program. And so on the exam itself, if you're taking the MCHES, a lot of weight is placed on process evaluation, program evaluation. I did formative evaluation, which is a type of evaluation that is done that will help in the development of a community health education program. So it provides information during the developmental stages of a community health education program to improve the program. Also, keep in mind the MCHE exam also covers research. I know that Dr. Weiner had alluded to the nuanced differences between public health and community health education, and she alluded to public health focuses more on policy, which is true, and on research. But at the Master Certified Health Education Specialist level, there's quite a bit of research that is expected, that competence in being familiar with differences between quantitative and qualitative research, instruments, whether it validity, reliability, in terms of qualitative, different types, phenomenology, ethnomethodology, and these are all community health education areas. For example, ethnography, for example, is a community health education area. More in terms of qualitative research, participant observation. In my particular research, I did quantitative, right? I used a survey. I used a community informant to gain entree to the community, to the target population that I was interested in. We conducted Street Intercept, another community health education strategy. And so it's an exciting field, very exciting. And I had been very fortunate to get into community health education. I'm so happy that I am been invited to teach at the master's level in the community health education program. I could go on to talk about more about my research. There's a correlation between what I looked at just very briefly was the homicide rates among young African-American men for two different reasons. One, not necessarily to advance community health education theory, but rather to make practical contributions to the field of community health education. And so that I'm just very excited about that. And so I thank you so much for listening.
Thank you, Michael. I want to specifically thank you for jumping in at the last minute when one of our speakers had to withdraw because of her work requirements. So thank you very much for joining us this evening and telling us about the CHES exam and the MCHES exam and your research. So thank you. Okay, I'd like to be able to open up the floor now to discussions and questions that anybody has. I want to thank David Hahn for being our producer. I want to thank Tina for her ongoing chat information to supplement what people are saying. I found it interesting and valuable. I also want to thank Kate Adler from the library who created a library guide for us. So anybody that wants to know more about community health education or just health education in general, there is a library guide page. And I put it in before. I think Tina can post it again for those who want to look at it. And I open the floor to everybody to talk, to post your questions in the chat, and we'll discuss them.
I do see that there's a question in the chat. Are there any, and this is from, and I apologize for any mispronunciations, from Chicane or Chicane Watson. Are there any CHE PhD programs?
Again, there are programs that may or may not call themselves community health education. Desiree, Professor Robinson still is in a doctoral program at Columbia in health education. I don't know of any other I think actually in New York, we do have another. Cornell Downstate has a program, I think, in community health education also, in a doctoral program. I don't know any others. Do any of you know of any others? Well, Barbara, you have it.
A public health program will cover a lot of what was talked about here under the community health education. So
And
if you wanted to further that, I would definitely suggest a public health program.
And I see Mr. Williams has his hand raised as well.
Yes, Hunter, where I attended, I got my MPA from Hunter. Then I actually went to Teachers College and did that health education program. Then at Hunter, there's a doctor of public health. And I think that the two terms intersect, whether it's public health or community health. And I understand what Dr. Weiner made those distinctions. You know, they're fine distinctions, but a doctorate of public health a community health education curriculum is subsumed, I think, under doctor of public health.
Yeah.
Rather than the PhD in public health.
Yeah, I think the thing is that PhD programs in general focus a lot more on research and policy and less on practice skills.
Yeah, I would also say that I think by the time you get to the PhD program, they tend to be a little bit more narrow in focus. And so they tend to be a little less general in that you can begin to sort of narrow the focus around like women's health or Black women's health, because they tend to be more research focused. They tend to really, you know, get a little bit more narrow in their focus as well.
All right, I see that we have a question from Patricia Smith, so I'm going to ask her to talk.
How you doing? One of the things that I was wondering when you were talking about the different degrees that can connect you with the community health education, a focus, and I'm thinking like in human services, because we have human services. I have a PhD in human services and counseling, and also I know one of my colleagues has a PhD in human services and health and communities. I went to Walden University. I have my degree from there, but I also have a certificate from Capella University. And I think at Capella, they focus on something that is similar. And I'm thinking that you probably could use some of those classes to get the certification as well. I'm going to see. Which, I mean, because it's interesting to me. I mean, Barbara had sent some information out on the different, she gave like I guess it's an outline on how you would get the degree, I mean, the certification. And in that outline, I see that some of the classes that we take in human services, and that you can use some of those same things. Whereas in social work, I don't think you can. And that's why I was saying, it's like the way it's connecting is kind of odd to me. I mean, when I'm listening to what everybody is saying and how it connects with the community and it connects social management. So basically, it sounds like to me that anything that's under behavioral science that focuses on some type of health ideology, you can use those same credentials to get the certification or work in the field. Am I right?
There's a list on the NCHEC website that explains how many credits you have to have in each kind of category.
Mm-hmm.
And again, work experience doesn't count.
I know, that's weird. Mm-hmm.
but you have to have some very specific courses. And some social work programs do have a concentration in health and wellness. But again, there may be other courses, you know, it's not 60% of the degree that's going to be in your health and wellness. I mean, in other professions that are licensed professions, they may have 2 or 3 other courses that could fit, but you know, social work, mental health counseling are very rigidly controlled by their licensing boards.
My other question is, if you do, you know, because Professor Robinson was saying, I know she's over at Columbia, but do you know if they have a postmaster's or master's certificate in something of that nature at your school at the time, or even at Hunter? Because I know Professor Williams said he went to Hunter, and they do have public health, and I know that City College of New York has public health program as well. But I'm wondering, do they have some for the people that we're in this? You know, we're working with the students in the field. I mean, me personally, I you know, I'm a school person, so I would like to know if there's a certification or a certificate that I could look into and pursue, so that I will be qualified to make sure that the people that I'm teaching, that I can also offer them what I'm telling them I need them for them to get. You know what I'm saying? Because I think it goes hand in hand. I mean, Michael and Barbara are certified, and I think it would be best that I try to be as well if I'm going to assist these students. I'm just saying, does anybody know anything?
That's a good question. That the courses that will qualify, you need 25 semester hours of coursework in community health education to sit for the checks.
Okay.
And is there a certification program that will provide those 25 hours? I'm trying to think. But on the bachelor's degree level, according to the National Commission for, you need 25 community health education specific courses to sit for the exam. So
Okay.
I'm not sure where you can, if there's just that certification alone, or you really offer 25 semester hours.
Well, Heidi just said that that they I think she said the NC. I didn't see the whole thing, but Heidi was saying that in that you could find out where to get the certifications from. I mean, to get the certificate from.
No, let's take a step back, because Heidi's asking a similar question. The National Commission on Health Education Credentialing is not an accrediting body. There is no accrediting body in this field. They do not keep a list of programs that meet the certification. They evaluate every individual student's transcript. So, for example, considering someone might not have a degree in community health education, but they took the 25 credit hours. And again, you have people in the military who have taken all this medical training that might qualify them. So everybody has to send in a transcript and be evaluated on their own. And they don't keep a list of organizations, programs around the country, because they're not certifying programs, they're certifying individuals.
Okay, makes sense.
Okay, and I'm going to answer Lorna's question. At the moment, MCNY does not have anybody in the career services office. They both left for other positions, and we are searching for them. As soon as we get someone in that position, they will be able to work with students to locate possible positions for them to work on their resumes, to practice job interviewing, to go over some of the different, if you look at the NCHEC listing that Tina put up about the Guide to Health Education Careers, it lists all the different titles that people with community health education degrees can have. And they get called all kinds of different things, partly because it's not a licensed profession. it's a fairly new profession. Public health is much older. I mean, public health goes back to the 1800s.
Mhm.
So if most of the public health programs will probably qualify you, to take the exam. But you take it, if you have a master's degree, you can take it. So there's no reason to get a doctorate except if you want to teach in a university or, move up in a government, in a public health setting or hospital setting, really. Those are the three settings that really look for doctorates.
Professor Robinson.
Hi, I wanted to address Lorna's question, and I would say in the meantime, until we get a career services person, I would definitely recommend tapping into the alumni network and, seeing who is out there who you can connect with, because that is also part of getting, an advanced degree, is tapping into the network. And so I would say reach out to Tina. I don't want to put more stuff on her plate, but I would definitely say in absence of a career services, it's always a very good idea to be connecting, going on LinkedIn and connecting with other MCNY alumni to see where they are, because we're everywhere. We're doing a lot. We have alumni come back often. And this, Lorna, we had one of our alumni come back who was running for office. And so because the community health is so expansive, there are, areas of public administration and, even me who works in media. So the field can be wide, and also there can be, many opportunities.
And during COVID, Tina's been highlighting the numbers of people from different programs that have been working in this field. Lorna, congratulations. I know you're the first cohort of graduates, and you're also taking your CHES exam this week. So I wasn't sure if you were going to show up.
We have Michelle and Lorna, two of our.
Yeah, Michelle too, but I don't know if Michelle is here.
Yeah.
So, oh, hi, Michelle. So I would say, that there are people you could connect with that you might not even think are they're in agencies that would use you. And I think the alumni network is a good place to go.
Professor Williams.
I just want to share with Lorna and Michelle the two prep books.
It's a little late. It's this Saturday.
Oh, this Saturday.
Yeah, they've been steady on it.
They have copies.
Just, make the 7 areas. So 7 areas is what they will cover.
They've been fast and furious studying.
Nice.
All right, Dr. Weiner, I don't see any other questions either in the chat or any other raised hands.
Okay, so I want to thank everybody for coming. This was our first attempt at a webinar for the community. And I want to thank you all for attending and coming and raising your questions. So thank you.
Good night, everyone. Thank you for joining us.
Thank
Good
you,
night.
everyone, for joining us. Take care, everyone, and be safe.